According to 2023-2024 Joint AIDS Review Report, which was launched today, the country is bound not to achieve its vision of eliminating AIDS by 2030 due to a number of factors embroiled in several categories, like behavioral, which involves persistent suboptimal retention on antiretroviral therapy, decline in condom use, ineffective awareness campaigns, among others. These have invariably enabled a persistent rate of new infections, currently at 7,300 per week.
The majority are coming from young people, especially adolescent girls and young women. And the main reason for this is the lack of awareness and lack of skills to protect themselves from HIV.
Nevertheless, the government insists that whereas its 2030 vision may not be possible, they still believe in their strategies already in play, given that the infection rate has so far dropped from 54,000 to 38,000 as of December 2023.
It still shows that our interventions are working. They are working because the numbers are coming down, but they are not good enough.
Since one of the factors undermining the country's 2030 vision being lack of knowledge about the HIV among adolescents, Dr. Vincent Bagambe reveals that they have undertaken more sensitization campaigns, which include translating the stigma and discrimination message into sign language.
To create awareness in this group, we have engaged with the partners to take messages through schools and through community groups. Radio programs are also ongoing. And in regard to the challenge of taking the messages to people with disabilities, we have translated the stigma and discrimination policy and guidelines into sign language.
The secretary in the office of the president, Haji Yunus Kakande, implored members of the HIV-infected community to emulate renowned AIDS activists like Phila Bongole Lutaya to mitigate stigma and discrimination of HIV-infected individuals within our communities.
I therefore call upon the community of people living with the HIV and the public at large to emulate such heroes like Dr. Stephen Watiti, Gideon Jamsha, I think he's here, and the rest who have emulated the late Bongole Lutaya and are publicly and positively living with HIV to bring an end to HIV-related stigma and discrimination.
The Minister for Health, Dr. Ruth Aceng, emotionally says that Uganda can't afford to slacken the efforts in achieving her 2030 vision now, given the close amount of funds spent on facilitating infected Ugandans, which would have been dispersed for developmental projects.
Imagine getting 38,200 new infections every year. Where we have come from was high. This is not good. We shouldn't even be talking about thousands. If we were talking about getting 5 new cases every year, that would be nice. But 38,200 is nothing to celebrate. So what I'm trying to push down into all our minds is that we all need to get very annoyed and determined to end AIDS, so that the rates of new infection are very low and we have money to develop the economy. Because anybody who gets new infection now, imagine at 20, 25 years, you have to keep that person on drugs for life. Perhaps until over 75, our life expectancy is 68. And that is every day of the person's life.
This year's symposium has been held under the theme, Accelerating Interventions to End AIDS by 2030, and was also blended with the celebration of distinguished AIDS activists like Phila Bongole Lutaya, who come out and publicly declare their HIV status to curb stigmatization and discrimination of the infected individuals in the society. Joseph Kabari, UCTV News.